Hello everyone, it's Dr. Joseph Danyo from Danyo Plastic Surgery. I am board certified plastic surgeon operating for 25 years now here in Greenville, Delaware. Today we're going to answer several questions about Renuvion, which is a new and exciting skin tightening technology that we have here in the office. So Renuvion is a machine that uses radio frequency energy to create helium plasma, and that is done through a device that is about 3 or 4 millimeters wide. It looks like a little wand. It has a button on it, and as we place the wand into the tissues that have been anesthetized with a lidocaine saline solution, that wand works through that tissue painlessly, creating the heat that is needed for that tissue contraction. How does Renuvion skin tightening work? And great question. The number one question people have is, what exactly is it doing? So there's two ways to tighten skin. The complicated way, which is to cut it out and tighten, which we're all familiar with, or to heat it. And heating tissues has been available in plastic surgery for roughly 20 years now, but not all heat is the same, and how it's applied, the technology used for the application of the heat, all make very big differences. So, for instance, I've been doing Smart Lipo now for 20 years. Smart Lipo is the original creator of surgical heat for skin tightening. And what that does is create a gentle long-term heat over 5 to 10 minutes and produces a result. However, a Renuvion is newer and better, in my opinion, in how it works. And what it does is it creates heat using radio frequency, and helium flows through the handpiece that creates a spark, which creates high heat but then also cools quickly due to the helium flow. And so what you're having is high heat, short duration, and that difference is creating better snapping back of collagen fibers, tightening of tissue, and actually working better than the slow, gentle heat of previous generations of devices. So where in the body can Renuvion be used? Starting from the top down, face and neck. So lower half of the face, upper neck can be loose. Patients don't want surgery necessarily. Renuvion would be great. What about arms that are a little bit loose or flabby? Maybe you've lost some weight. Again, another excellent place for a good result. Most patients would prefer avoiding the surgical scar to tighten the skin, so arm skin tightening is great with Renuvion. Abdomen skin, perhaps you've had a baby, there's been stretching, perhaps weight loss, maybe just age-related skin laxity, not ready or desiring a tummy tuck, Renuvion is great. Particularly excellent for use is the upper and lower back. These areas are not typically great for surgical skin excision, or at least not desired by patients, and liposuction alone doesn't solve the excess skin problem. So tightening that skin with Renuvion is a great choice. Front of the thighs, inner thighs, top of the knee. Again, most people don't want thigh lifts, and they're not indicated in most people. Renuvion to tighten that skin is great. So how many treatments will be necessary to have a good result with Renuvion? So Renuvion is really designed to be a single procedure. It's not thought of as requiring 2, 3, or 4 sessions to see an achievable result. One time is enough, and most patients are happy with that one procedure. Is Renuvion painful, and does it require anesthesia? Unlike other laser treatments or machine treatments that you may have had to tighten your skin, such as Genius or CO2 laser or any other modalities, oftentimes done in med spas or doctor's offices with estheticians, topical numbing cream is not enough. So what we do is inject a very gentle lidocaine solution slowly, and over a period of 5 to 10 minutes, the entire area is surgically numbed, so that when the Renuvion wand is entered into the tissue, you literally feel absolutely nothing. Numbing is slightly painful, but can be done easily, and done slowly, it's barely feelable. Can Renuvion be combined with other procedures? The answer is yes, and that procedure typically is liposuction. So If we're here in the office, we're oftentimes in a targeted, limited area. So for instance, if we're treating arms, many times there is excess fat in the arms plus loose skin. So we would numb the fat with that numbing fluid that we discussed earlier, and that would make the liposuction possible. And then with the fat removed, we would place the Renuvion wand into the tissue to create that shrinking effect to help improve that liposuction result. In the operating room, we have obviously more power to do more body areas, sometimes more extensively as well. So for instance, it would be not uncommon to do many liters, say 6 or 7, even up to 8 liters of liposuction of arms, abdomen, back, thighs, and then decide which areas, maybe all those areas, would benefit from Renuvion skin tightening as a general anesthesia procedure as well. So the point is that it's not always a office awake procedure. It can certainly be done asleep in the operating room for larger cases. So why would Renuvion not be recommended if you do indeed have loose skin? And that's a judgment question, of course. So Renuvion is a excellent machine. It's been proven to work very well. However, it's not a miracle machine. So if you've lost massive weight, have a large amount of skin laxity, a large amount of stretch marks, overhanging skin, these are all common issues that are probably best treated with surgical excision. So Renuvion is working for laxity, but not extreme laxity, and it's important to have realistic expectations, and also for the surgeon to give you realistic expectations as well. So what should I expect after my Renuvion procedure in terms of healing and downtime? So that's going to vary depending on what area was treated and how much liposuction, if any, was done. So for instance, if we're doing a abdomen and back in the operating room and it's 5 liters of liposuction, about 98% of that recovery will be the liposuction, not the Renuvion. So Renuvion itself isn't a high recovery procedure, but the liposuction sometimes can be. If we're doing a face and neck, for instance, oftentimes no lipo is necessary, and therefore you're not going to be fatigued and anemic and tired or anything. And oftentimes you may not even be bruised. You'll probably have minimal pain, just a little bit of gentle tenderness for a week or two. Swelling can last for several days to a week or two, but again, not prolonged recovery for Renuvion treated tissue only. Is it possible to repeat a Renuvion treatment? And the answer is yes, assuming that there's been some result achieved and that you're a reasonably good candidate, expectations are being outlined. Another one can certainly be done safely. Typically that would not be done before 6 months from the first treatment. If one treatment works, a second could possibly work even more. So I'm very excited about Renuvion. It's a definite improvement over older technologies in terms of tissue tightening and heating. It's been showing itself to be very effective as well as safe and comfortable for patients. So if you're interested in making yourself look better, maybe some lipo, maybe some skin tightening, Renuvion could be an excellent choice for you. You can find us on the web, of course, at danyoplasticsurgery.com. There's plenty of information there as well regarding Renuvion. You can book an appointment online. We can do virtual consultations and, of course, in-person consultations. Our office number is 302-888-0508, and that's danyoplasticsurgery.com. Thank you for listening.